RC2 is your vaccine central, and we're tracking the efforts to vaccinate children. Pfizer now says that a COVID vaccine for kids ages 5 to 11 could come by this winter. But they also suggest the spread of the Delta variant may potentially pressure regulators to act even more quickly. Let's get to Haley Hernandez now, our health reporter. So do we know, based on this local trial, when vaccines for kids will be available?
Yeah, you know, data from local and national trials show that vaccines for children could be available in maybe about a month. So once the data is submitted to the FDA could then give it emergency use authorization, which would mean that kids 5 to 11 would be eligible for a vaccine. Pfizer believes they could receive emergency use authorization in late fall or early winter, while Moderna is still trailing slightly behind them. Dr. Jim Versalovic with Texas Children's Hospital says they're studying over 100 kids and are ready to show the vaccine is safe and effective in young children when given the age-appropriate dose.
We do know that the trials for young adolescents were also separately done and completed in early 2021 for very good reasons, because we do need to have these children monitored carefully by pediatric specialists, and also to note that the dosages and the scheduling of these vaccines may be different in children.
And parents are already trying to determine what they'll do.
Well, we actually all had COVID and we recovered from it. So, and they really weren't that sick when they had it even, so I don't know. I never had the flu vaccine. I've never gotten the flu.
I would feel comfortable to give my children a vaccination once the research is there and it's proven to be safe and effective for them as well.
Dr. Versalovic says he will recommend all pediatric patients get it because he expects the safety data will be convincingly positive.
We are confident that sometime in October we can get emergency use authorization for the 5 to 11-year-olds, school-age children.
Now, some of you might be wondering, what do you do if your child already had COVID? Should you get the vaccine or not? Dr. Versalovic stands by the idea that he says a vaccine provides a more robust response to a COVID infection, and therefore he says that the vaccine is better than natural immunity. Reporting live from the Texas Medical Center, I'm Haley Hernandez, KPRC 2 News.
Haley, thank you. A number of new laws are